So this video is about Assessment 2 for NSN 008. And this assessment really brings together all the elements from the unit content into a case study of a person that you provide care for. So the first thing you need to do for this assessment is to identify that somebody that's living with at least 3 chronic conditions, which will be the focus of your case study. So this person should be from your own practice setting. If you're not working clinically or you have no access to patients, then there is a scenario provided in the assessment description, and it details a range of clinical and social circumstances of a person. If you are using a person from your own practice, it's really important to maintain privacy. So please describe them without identifying details. So use a pseudonym. No details of where they live, and no naming of the health service where they get their care. So in your introduction, you need to present your case study, so your person. The introduction needs to be crafted to highlight issues that you aim to address in the body of your essay. So don't include excess detail that you're not going to then follow through to the rest of the assessment. Then next, you need to highlight 3 signs or symptoms that are of concern to that person, and then discuss how these symptoms interact and what are the main impacts for that person on having these intersecting symptoms. And then after that, the bulk of the essay will then discuss critically the nursing care of that person. So this nursing care needs to be in the context of their high priority needs. So you need to explain what comprehensive person-centred nursing care involves for that person. So being critical means taking the key principles that you've learnt from across the 3 modules and applying them to the case study. So the case study becomes the focus where you demonstrate that you understand and can apply concepts learnt in the unit. So you're not just describing something that's written in a journal article. So what kind of concepts? Things like social determinants, strengths, symptom management, integrated care, collaborative leadership of multidisciplinary teams, supporting self-management. Why are these things important for that person? That's where you need to get the evidence and critically discuss it. So in this, your role as a nurse in relation to that patient needs to shine through. It's an opportunity to demonstrate that you, as a skilled practitioner, can apply what you've learned into practice. So things to avoid. Avoid focusing on one chronic disease and its treatment. We've moved on from that. Avoid scenarios where patients are going to multiple different specialists and different appointments in different places. We're looking for alternatives to that. They will have complex care needs, but the challenge is discussing how their care can be integrated and coordinated better, and your role in making that happen. So avoid the acute care perspective. People will have short-term clinical issues that need addressing, but you need to avoid focusing on those with no covering what happens to them once they walk out the door. So a really important part of chronic care nursing is around that follow-up and proactive consideration of their long-term outcomes. So to help with this task, in the task description there's a framework, and it's from a journal article by Grembrowski et al., which is reading 14 in module 1. The framework's all about complexity, but the key to dealing with complexity is to put the person at the forefront of your interventions. What are their needs? What are their strengths? What are their challenges? And what do they want? So prioritising and streamlining care along those lines is what I want to see. So it doesn't have to be a long list of priorities, but think critically about how using nursing interventions to address some priorities might flow through and have a positive effect on other areas. I would rather see a well-considered response to a few key priorities than a list of symptoms and remedies with little regard to the impact of that treatment on the person and their family. So, critically, that framework covers social and emotional aspects of care, not just physical. So it is very complex, but that's why it's a good framework. So, nursing roles are central to this case study. I want to read about your role and other nursing roles. So think about advanced practice nursing roles, acute and primary care nursing roles. Where do they sit in the integrated care of this person? So again, it's worth 3,000 words and it's worth 60% of your mark. So it's really important that you narrow down your person early. So that you can identify key priorities and then describe that tailored intervention. Contact me if you're experiencing any challenges. I welcome emails. Please, though, not at the last minute if you can help it, but I would aim to help you if I can. Thank you.